BSI, seen safe. My mechanism of injury, nature of illness, is going to be chest pain. I am going to have one patient. I will not consider C-spine, but I will consider ALS at this time. My general impression is I have a 50-year-old male in respiratory distress, experiencing chest pain. He is clutching his chest, appears pale, anxious, and diaphoretic. So I notice the respiratory distress. The first thing I'm going to do, give him 15 liters per minute of oxygen, be a non-rebreather. All right, sir, I'm going to ask you a couple questions, okay? Okay, can you tell me what your name is?
Mike.
Mike. All right, Mike, can you tell me where you're at right now?
In my bed.
In your bed. Can you tell me what time of day it is?
It's the evening.
And what'd you call us for?
Chest pain.
All right, we'll see if we can get that looked at for you. So I have now determined that my patient is alert and oriented times 4. I do not hear or see any airway obstruction. My airway is patent. I'm going to go ahead and count his respirations for 30 seconds and multiply it by 2. Let's say his respirations are 16 per minute, but labored. I've already given him oxygen, so I'm now going to take a pulse for 30 seconds, multiply it by 2, and let's say his heart rate is 78, strong and bounding. I'm going to assess his skin coloring, temperature, and condition. Let's say it's cool, pale, and diaphoretic, okay? I'm going to immediately transport this patient because he is having chest pain, okay? So we're going to load him into the back of the ambulance and get on our way. Now I'm going to be taking a history on my patients. So we're going to start with our sample history. So besides the chest pain, are you having any other symptoms you want me to know?
No.
No? Are you allergic to anything?
Penicillin.
Penicillin. All right. Are you on any medications, anything, including over-the-counter?
No.
No? All right. Do you have any past history, medical history I should know about?
No.
No? When's the last time you had anything to eat today?
This morning.
This morning? What time this morning?
Oh, breakfast.
Breakfast time? Was it 9 a.m., 6 a.m.?
8 o'clock.
8 o'clock. All right. And you said you were having some chest pain. That's why you called us?
Yes.
All right. So tell me, was this pain a sudden or was it a gradual?
Gradual.
It was a gradual onset. Does anything make it better or worse?
If I get up and walk, it hurts more.
If you get up and walk, it hurts more. Can you describe the pain to me? Give me some words.
Squeezing.
A squeezing, heavy squeezing pain. Does it move anywhere or does it stay in one spot?
It seems to move into my left shoulder.
All right, so the pain moves into your left shoulder. On a scale of 1 to 10, 1 being absolutely no pain, 10 being the worst pain you've ever experienced in your life up until this point, where would you rate it?
8.
An 8. And is it constant or does it kind of come and go?
It's constant.
It's a constant squeezing pain. All right, so what I'm going to do now is I'm going to take a look at the affected body part. At this point, it's going to be the chest. So I'm going to visualize the chest. I'm looking for any decap BTLS. I'm going to palpate the chest, looking for any deformities. No? All right. I'm going to auscultate the chest. Take a listen to his lung sounds. I'm going to listen here. I'm going to listen here. I'm going to listen here. And I'm going to listen here. All right. So now I'm going to get a set of vital signs. I'm going to go ahead and retake a pulse. Let's say his pulse now is 90 beats per minute, strong and bounding. I'm going to reassess his breathing. Still 16 times a minute, but it's no longer labored. I'm going to go ahead and take a blood pressure. All right, let's say his blood pressure is 180/120. So with the information, I'm going to call medical control and request permission to give aspirin and nitroglycerin. Okay. I suspect that this patient is suffering a cardiac event such as an MI. So after administering the medications, I'm going to wait about 5 minutes and I'm going to reassess my patients. I'm going to recheck a pulse. I'm going to take a blood pressure, and I'm going to ask him, sir, how's the pain now?
Pain is better.
Pain is much better. That's good to know. On a scale of 1 to 10, where would you put it now?
2.
A 2. I like the sound of that. Let's say his blood pressure is now 140/90. So now I've completed this assessment. I'm going to call in to the hospital and I'm going to give a report. Okay, so I'm going to have a 50-year-old male currently en route with chest pain. Patient presented with a gradual onset of a squeezing chest pain that radiates into his left arm. We have treated this patient with 15 liters per minute of oxygen. We've also given him 1 dose of nitro and aspirin. Patient states that his pain is improved, and we will be there in 10 minutes. Do you have any other questions or standing orders? And I'm done with this go.